Let's talk a little bit about dry eye disease. As a dry eye specialist, probably 90% of the patients that I see suffer from dry eye disease, and I have it myself. When you have dry eye disease, it's more than your eyes just feeling dry. Your eyes feel irritated. You constantly feel like you have something in your eye. The most common symptom of dry eye disease is blurred vision. So your vision really fluctuates as you blink, and it is difficult to see clearly when you have dry eye, and it can be quite painful as well. And the eyes can feel as though they constantly have abrasions or feel as though something is kind of sticking or jabbing you in the eye all the time. So it's more than just a minor annoyance for a lot of people. How do we treat it? Well, dry eye disease has multifactorial. There's a lot of reasons why someone might develop dry eye disease, and those reasons can directly impact on which treatments are going to be most successful. Treatment for dry eye disease is a tiered approach that starts with a foundation of omega-3 fatty acids to improve the oily layer of the tears, which is necessary to keep the tears from evaporating that you're making, combined with possibly some prescription eye drops that help your eyes to make more tears or reduce the inflammation on the front surface of the eye. Sometimes combined with different devices that we use for sleeping, because people sleep sometimes with their eyes open, believe it or not, and that will dry out their eyes. So sometimes we have to use special devices for sleeping. We always recommend that people do not sleep with ceiling fans on. I know people love their ceiling fans, but that constant movement of the air is really not a good idea for dry eye patients. And the blowers in the car should never be right on your face. Again, not a great idea for dry eye patients. So there are environmental concerns that we look at. We also utilize humidifiers, like room humidifiers in the wintertime, and that helps a lot as well. That is the basis of basic dry eye treatment, but it can get much more involved in that for the more moderate to severe cases. We have a piece of equipment in the office called a Lipiflow, and what Lipiflow does is it helps to clear out blocked meibomian glands that can contribute to dry eye disease for people that have some problem with the clogged glands in their eyes. There's also other surgical procedures like IPL, which is a laser that is utilized for dry eye disease. And there are some advanced medications like biologics or stem cell therapy, amniotic membranes, things that we can utilize in more severe cases. So if you're suffering from dry eye disease, there's certainly plenty of things that we can do. We usually start with a simple approach with nutrition and eye drops, and then go from there as the patient needs it, depending upon their symptoms and how their vision is and how comfortable their eyes are. So keep in mind that there's plenty of things we can do to help you. If you have dry eye disease, just call and speak to one of our doctors. Thank you.